Congratulations on the birth of your new baby on behalf of Oman International Hospital. We wish you and your family a safe transfer home following your stay with us. In this video, you will find key pieces of information that are important to remember when being discharged home. Please note this video provides general information and is not tailored specifically to your individual care needs. The subjects covered in this video are cleaning your baby's eyes, changing nappies, bathing your baby, making sure your baby is safe when they're asleep, and mom's recovery from birth. It is quite common for babies to get slightly sticky eyes. This usually looks like weepiness from the corner of the eyes, and it can be white or yellow. If it turns green, make sure you speak to your doctor. To clean the eyes, use cotton wool and cold boiled water, and do a single wipe from the inner corner of your baby's eye to the outer corner of your baby's eye. And then throw that piece of cotton wool away and use a clean one for the next wipe. Disposable nappies are very good at absorbing fluid, and it can be hard to tell if they are wet or not as they draw the fluid away from your baby's skin. Now, most brands have a wetness indicator on them, which changes color when it is wet. Often this is yellow line down the middle of the nappy, which goes blue when it is wet. You can see it in the picture here. The contents of your baby's nappy can give you a really good idea of how well your baby is feeding. It's worth having an idea of what to expect. On day 1 and 2, you should expect about 2 wet nappies a day and at least 1 dirty nappy. The stool will be black called meconium. On day 3 and 4, there should be at least 3 wet nappies and 2 dirty nappies. The stool should be beginning to change. It will go from black to green to yellow. As the stool goes yellow, it tells you that there's milk all the way through your baby's gut, and therefore your baby is feeding well. On day 5 or 6, you should have at least 5 wet nappies and 2 dirty nappies. You may see some rusty red spots in your baby's nappy along with urine. These are salts that are flushed out of the kidneys, and they're normal in the first few days. But after the first couple of days, they can be a sign that your baby is dehydrated. So if you see them after about 3 days, see your doctor. Baby girls sometimes have a bit of vaginal mucus, which you may see in the nappy or around the vulva. This is often clear and stringy, a bit like egg white. It may have some blood in it. This is completely normal and is a result of your hormones, which she was exposed to before she was born. It will go away in a week or 2. Your pregnancy hormones can lead to babies getting swollen breasts. This can affect boys and girls. Again, it's normal and the swelling will go away after a few weeks. So don't worry about it. We will bath your baby after 24 hours of their birth. When you bath your baby at home, there are a few things you can do to make sure that it is a good experience for both of you and your baby. Make sure your baby doesn't get cold. If your baby gets cold, they won't enjoy their bath. First, make sure the room's warm, so when you strip baby off, they're not going to have a shock being in a cold room. Before you bath your baby, the water should be warm enough, but not too hot, because baby's skin burns quite easily. You can judge the water temperature by dipping your elbow in the water, and it should feel warm to touch. If you are using a thermometer, the temperature of the water needs to be around 37 degrees. If you're asking yourself how often you should bath your baby, then that's a very personal choice. Your baby isn't really getting dirty, so you can clean them well enough by topping and tailing them. When your baby is born, the cord that links your baby to your placenta is clamped and cut. The clamp is a small plastic clamp, and this stays in place until the cord falls off, which takes anything between 1 and 3 weeks. To start with, the cord is creamy in color and quite thick and fleshy. Over the first few days, it turns black and shrivels up. It may have a slight odor, which is usually normal, so long as the skin around your baby's cord stays healthy looking and doesn't become red or inflamed. The best thing to do with your baby's cord is nothing. Just leave it alone. Don't put any talc or cream on it. There are very firm recommendations about how you make sure that your baby is safe when you put them down in a cot to sleep. One of the most crucial ones is that your baby sleeps on their back with their feet to the bottom of the cot and the blankets over the top of the baby tucked in down the sides of the mattress like in an old-fashioned bed. It is important that your baby doesn't get too hot when they're asleep, so your baby doesn't need a hat in the house, and certainly not when they're asleep. So your aim will be that your baby sleeps in a room with a temperature of about 18 to 20 degrees, and they need enough blankets or clothes to keep them warm. To judge that, pop your fingers down inside the vest and feel how their body feels. Your baby should feel warm to touch, but not hot. They should feel like your body feels. There are a few other things to think about keeping your baby safe, and that is, no one should smoke around your baby. Now let's talk about some issues that affect moms after they give birth. After your baby's birth, vaginal bleeding will last on and off for up to 6 weeks. In the first 24 hours, it will probably be bright red, and you may get few small clots. If you notice any big clots, please speak to your nurse or midwife. They may want to see the clots, so save it on a pad. After 24 to 48 hours, the bleeding should become darker, and over a period of a few days will go brown, then pink, and then watery. But it can fluctuate between red and brown. If you are not sure about your bleeding and you think it's too heavy, please speak to your doctor. You will need big pads like the ones in the picture. You can use these or choose to use incontinence pads because they're absorbent, comfortable, and won't rub against your stitches. After vaginal birth, it is very common to have some stitches in your perineum. Keep these clean by changing your pads regularly. With cesarean section stitches, you will have a dressing over these, which will be taken off after 24 or 48 hours. Just wash your wound as normal in the shower. Your doctor will prescribe pain relief medication to take home. Please take them as prescribed. A hemorrhoid is swelling of a vein in the rectum. Many women experience having hemorrhoids during the pregnancy, and some women only have it after the delivery. It is very common, and some hemorrhoids will disappear in the first 2 weeks after birth. Symptoms include pain, itching, and sometimes bleeding. Avoiding constipation is very important when having hemorrhoids. Some helpful tips include: eat high fiber foods such as fruit, vegetables, brown bread, brown rice, or pasta. Drink plenty of water, at least 2 liters a day. It will also avoid constipation. When sitting, use a donut pillow or use sheet or towel to make a donut shape to relieve pressure on the rectum. Creams and ointments are available to help with the healing. Painkillers can be taken as prescribed by your doctor. Try to start pelvic floor exercises as soon as possible after you give birth to your baby. This might be quite difficult at first if your perineum is sore. To do pelvic floor exercises, squeeze between your legs as though you're trying to stop yourself going to the toilet. But don't do it while you're going to the toilet. So squeeze and hold for the count of 10 if you can, then relax for the count of 10. Try to do this 3 times a day. This will help your pelvic floor recover from giving birth and reduce your chances of having any incontinence when you're older. It is essential that you take some time out to look after yourself. You need to take time for a shower, eating, drinking, and just doing all the things that you need to do to make yourself feel okay. Eating and drinking is important. You may find your appetite isn't as good as it was, but make sure you eat anyway. When you sit down to feed your baby, make sure you have a glass of water next to you. You'll probably get quite thirsty when you're breastfeeding, as breastfeeding takes a lot of fluid out of your body. Resting and taking a pause are essential for the postnatal period. Although it can be challenging in finding time to rest, you should strive for it anyway. Try sleeping when the baby sleeps. Even if you are not sleepy, it's good to lay down and rest in bed. The transition to motherhood can trigger a mixture of powerful emotions, from excitement and joy to stress and anxiety. Many new moms experience postpartum blues after childbirth, which may include fatigue, sleep disturbances, stress, and even anxiety and mood swings. These emotions usually subside after about 2 weeks as mother and baby adjust to each other. As many as 1 in 10 women experience a more severe form of emotional distress known as postpartum depression. Typical symptoms include marked changes in sleep, appetite and energy levels, and feelings of sadness, hopelessness, isolation, and anxiety. Postpartum depression isn't a character flaw or a weakness, and many women who experience it are not alone. Highly effective treatments are readily available. If you are concerned at all about your emotional health, talk to your obstetrician. If you have any concerns about your own or your baby's safety, then seek help immediately. You will need to see your doctor 2 weeks after the birth of your baby to ensure that you have recovered well. Your midwife or nurse will book the appointment for you. Your baby will also be seen by the doctor, who will do some checks to ensure they are developing well. But before you leave the hospital, we will need to ensure you have a car seat that's properly installed for your baby's safety. If you don't have one yet, don't worry. Ask us about purchasing one. Thank you for watching. I hope you found this helpful. If you have any questions, please speak to your nurse or midwife.